Greetings, VB Rescue members and guests. It's great to be here to chat with you again today. Thank you to everyone for all your hard work this summer. You did amazing things on the beaches, in the neighborhoods, and on the streets. And while Labor Day marks the unofficial end of summer, you know things never really slow down in emergency medical services. I'd like to talk to you today about some of the things we're working on in terms of member intake, training, and performance metrics. First, let's talk about the intake of new members. I'm happy to report that staff continues to find ways to streamline the intake of new volunteers to get folks in here faster. We're also working to help coach our EMT graduates to increase our test pass rate on the National Registry exam. Recently, the Virginia Office of EMS published a report that showed that Virginia Beach EMS is the most prolific training center in terms of EMTs in Virginia. 360 EMTs have been certified by our program over the last 3 years. So thank you to everyone who's assisted with our recruiting and marketing and bringing in new folks. I want to give a special shout out to the Virginia Beach Rescue Squad Foundation for their continued investment in marketing. We've had a lot of folks come in this summer. Our latest class started on August 29th, and we have 2 more classes slated before the end of the year. The September program is unique because we're going to try to have classes on Saturdays instead of weeknights. We'll let you know how that goes. On the career side of the house, we've also completed a number of hiring processes since July 1st. As you'll recall, City Council approved us to hire 20 additional medics for the field, as well as a captain, medic, and support staff for our training division. We also had several people who retired or moved on to other career fields. And when an officer retires, that's good because it creates promotional opportunities, but it also has a cascading effect that we then have to have promotional or hiring processes as folks come in to backfill. I'm proud to report that the training and HR staff really came together and put a lot out this summer, and over the past summer we have hired or promoted 1 deputy chief, 2 division chiefs, 2 brigade chiefs, 4 captains, and 3 support staff. For the career medics, we've run 2 medic orientation programs with 13 new folks. They're in various stages of their orientation process now, and a 14th medic will join us before the end of the month. All of that combined leaves us with 14 additional vacancies for paramedics in the field. Last week, we conducted another interview process that included paramedics and intermediates. We're working with HR right now to compile those results and to make some offers. That cadre should join us sometime in October. Now, if we don't fill all of the 14 medic vacancies with this last round, we'll regroup to look at our options. Adding staff, whether it's volunteer or career, is critical. More ambulances helps reduce the burden on you. It improves response times, it improves patient care, and improves morale. Staffing is critical to our success. Now, switching gears, I want to talk about clinical performance. Last month, we were named by by the American Heart Association as a Gold Plus Mission Lifeline community. This recognizes our achievement of a number of metrics related to cardiac care, particularly timely acquisition of R12 leads and transportation to a STEMI center. We only achieve this prestigious status thanks to your attention to detail on cardiac cases. I also want to thank Captain Will Shackelford and the performance management team for all their effort to put together the data required for this application. Very few communities achieve the Gold Plus status. While I'm proud of what we have achieved, our internal research shows that there are still some areas for improvement, particularly with on-scene times. Now, I think everyone intuitively knows that on-scene times are important for things like trauma, STEMIs, and strokes, but our times are consistently higher than our target of 15 minutes. Now, I know there are always situations that cause a delay at the scene, but overall, most of our cases are not that complicated. So we're asking everyone to focus on prompt packaging and patient movement, particularly when you have a patient impression of a stroke, TIA, or a STEMI. Use all providers at the scene, ALS, BLS, firefighters, work together to expedite that patient movement to the ambulance and off to the hospital. I'm confident with a little more attention to detail, we can improve our on-scene time measures. Now, I mentioned last month in the last video that we are going to be doing a whole blood initiative. That's coming soon. We're about to do the training. We're just waiting for a little more equipment, but we'll be deploying whole blood on EMS 1 in the first phase. We may expand that to EMS 2 in the next phase, but it's going to depend on blood supply and work we're doing with the Tidewater EMS Council and trying to balance the availability of blood between us and, of course, other communities. Now, speaking of that supply, part of participation in the Whole Blood Initiative requires us to sponsor some blood drives. Tidewater EMS already has one on the calendar, and we will be scheduling one in the coming months. Now, that doesn't mean every VB Rescue member has to donate blood, but we are going to encourage folks to come out and give blood because this is a unique opportunity to donate blood specifically that's going to go help EMS patients. So I think that's pretty exciting. Now, no message would be complete, of course, without me talking about infectious diseases. COVID and monkeypox are still out there. In terms of COVID, I think everyone is proficient now in our protective measures and PPE requirements. So please, remain aware, use your PPE, consider getting vaccinated and boosted. I understand there's a new COVID vaccine cocktail that's going to be coming out soon that is formulated to help address some of the latest variants. Now, in terms of monkeypox, EMS is not considered a high-risk group for monkeypox, but monkeypox is spread through direct contact or contact with contaminated linens. So continue to use your universal precautions, wear your PPE when touching patients, and be especially cautious when you're cleaning up your stretcher. Wear your gloves when you're handling linens, and of course don't bundle them up to your skin or to your uniform. Monkeypox vaccines are available through the health department, and while EMS providers are not a target group for that, much like any other infectious disease, I encourage everyone to do your homework and determine whether getting a vaccine would be potentially benefit for you. Do your homework. So, last but not least, I am very happy to report that we will be holding our fall family picnic at Red Wing Park on September 24th. So mark your calendars, September 24th. I hope to see you there. That's all I have for you today. Thank you again for your great summer and your service to VB Rescue and the City of Virginia Beach.